Radiosurgery is a treatment which uses highly focused, intense beams of radiation to destroy abnormal tissue in the head. Though the concept of this treatment was first proposed in the 1950s, it wasn't until the early 1990s when computer and X-ray scanning technology allowed the practical application of the procedure. Since then, its effectiveness has been established through the treatment of thousands of patients for a wide variety of medical conditions. The name of this treatment, stereotactic radiosurgery, is derived from terms that describe the technique and intent of the procedure. Stereotactic describes the technology which is used to aim the radiation at lesions inside the head using three-dimensional CT and MRI scans combined with landmarks and mechanical devices on the surface of the head. Radio refers to the ionizing radiation which is used to destroy the abnormal tissue in the head. Surgery is actually an inaccurate description of the procedure, as the treatment is non-invasive and no cutting is involved. It is used, however, to describe the application of the radiation in a one-time, high-dose treatment intended to destroy the tissue it hits, in a way similar to removing that tissue as is done with conventional surgery. Using the term surgery distinguishes this procedure from more common types of treatment with radiation, which are less precisely aimed and delivered over several days to minimize the damage to the normal tissue which they hit. Radiosurgery is usually done as an outpatient, starting first thing in the morning. No food or drink is permitted after midnight on the day of the treatment, with the exception of small amounts of water for prescribed medication. Bring any medications that you regularly take with you, so you may take them at the appropriate times during the day. Comfortable, loose-fitting clothing should be worn. Watches and jewelry should be left at home or given to a family member to keep during the day of the treatment. A nurse will greet you and show you and your companions the room where you will stay while the treatment is being planned. A television, VCR, and telephone are provided for your comfort and convenience. Next, the nurse will obtain your vital signs and a brief examination will be done. An IV is started to administer medications and to give the contrast dyes that are used for your X-rays that day. The first step of the radiosurgery is to attach the stereotactic ring to the head. Although you will be awake throughout this procedure, intravenous medication and local anesthesia are given to ensure there is minimal discomfort. The ring is attached to the head by 4 small pins which keep the ring rigidly in place until the radiosurgery is completed. The ring can cause a sensation of pressure in the head, and pain medication can be used during the day for this if necessary. The next step in the procedure is to obtain a CT scan of the head. An MRI scan is often needed as well. This may be done prior to the day of the radiosurgery, or, in some instances, with the ring in place. Occasionally, an angiogram is also necessary, depending on the type of lesion being treated. The images from the scans are then transferred to a computer system where they are reconstructed into three-dimensional images used to plan how the radiation beams will be shaped and aimed. This is often the longest part of the procedure and can take several hours, depending on the complexity of the treatment. During this time, you may relax in your room and eat if you wish. Family and friends are welcome to visit and help pass the time. Once the radiation oncologist and neurosurgeon have finished planning the treatment, the radiosurgery apparatus is prepared for the actual procedure. Medical physicists do a run-through of each treatment to check the calibration and accuracy of the equipment. The radiation for the treatment is generated by a special linear accelerator which can deliver highly focused radiation beams with an accuracy of less than half a millimeter. The treatment begins by attaching the head ring to the radiosurgery table, which keeps it very still during the treatment. A laser localization device is used to precisely position the head. The initial position of the linear accelerator is then set, and the medical staff leave the room. During the treatment, the accelerator moves in a continuous circle around you, coming close to, but not touching your head. The machine makes a buzzing sound, but there is no discomfort or sensation from the radiation. Though no one is allowed to stay with the patient during the treatment, family and friends may observe the treatment over closed-circuit television if they wish. In between segments, the physicist and treating therapist come into the room to reset the position of the linear accelerator and table for the next segment. The total duration of the treatment can vary between 15 minutes and a few hours, depending upon the complexity of the treatment plan. When the treatment is finished, the headring is disengaged from the accelerator. The headring is then removed and the pin sites are cleansed and covered with small bandages. In most instances, you may then leave for home immediately. Over the next day or two, you may have some fatigue and should limit your activity. Applying ice to the pin sites where the headring was attached will help to minimize swelling in the forehead and around the eyes. Typically, normal activity may be resumed after 48 hours. The risks of radiosurgery are very dependent upon the location in the brain of the lesion that is treated. In some patients, pre-existing neurologic symptoms may worsen in the first few weeks after treatment because of swelling around the lesion. A course of steroid medication can be given to treat the swelling if necessary. Some patients may have an increased risk of seizures for several days after the radiosurgery, though this risk is small when anti-seizure medications are given preventatively. A small number of patients will have injury of the normal parts of the brain immediately next to the treated lesion in the months following the radiosurgery. Again, the symptoms this may cause depend upon the location of the treated lesion in the brain and are often successfully treated with steroid medication. The radiosurgery team will discuss your specific risks with you prior to the procedure. In a very few cases, irreversible injury or necrosis may occur, which could require surgery to treat. Your physicians at University Radiation Oncology and the Mayfield Clinic have experience performing many hundreds of radiosurgery procedures. They will discuss specific details of your case with you prior to your treatment. Please make them aware of any questions or concerns you may have about your radiosurgery.